So we're looking at bunions here, and you can see bunion is a formation of basically your big toe goes away from the midline, and most often bunion is presented with other presentation of the toes. While most people, or a lot of people, think bunion is something you inherit from your parents, it doesn't have to be, though it could be. But the good news is it doesn't have to be permanent. What we want to do is we have a muscle that goes from the inside of your foot, from where the arch is, that gets connected to your big toe, and it keeps it out here. Of course, there are exercises. I've done videos on how to exercise those muscles. If you haven't subscribed to the channel, you may want to reconsider what you're doing. But back to the bunion situation, we want to exercise the rest of the toes. So instead of having the hook or hammer toe here, we want to create the crease. So go ahead and press down. That's what I'm referring to. So give your feet the ability to have a better grip instead of your big toe going in that direction as the rest of your body is going towards the inside. So to tape the bunion, what I'm going to do is I'm going to measure the distance from the arch. So if you come over on this side, we're going to measure the arch here. We're going to measure the arch here and go over to this area. So we don't want to go all the way to the tip. We want to go from close to the joint right here and go a little bit in that direction. So what I do like to do is I'd like to cut close to the big toe. So I'm going to cut this a little bit more. I'm going to round out the edges. Then I'm going to cut the tape. Go on the side. Don't lift the leg up. We're going to place it there. I'm going to take the part that's closest to the floor first. Bring it down. Take the other side off.
Are you putting any tension?
No tension. Not with this tape. I like rock tape, and rock tape does not require any tension in the tape. I do like to bring the big toe out. Keep it there. So keep your big toe in place. Cut another piece. So bear in mind, tape is not going to keep the area in place. It's more of a sensory stimulation to the brain to assure, it keeps the area in place. I'm going to place it right there. Take the tape off and go all the way. Keep it there. The big toe is there. Keep it all the way there and go up like so. I also do like to support the arch, transverse arch a little bit. So I'm gonna cut this once again, round the edges, and just support close to the transverse arch. This is the transverse arch. You want to be at the 90 degree and support it, and I'm gonna place it right at the arch. Don't pull, not on the rock tape, and just go across. So the tape is basically going to keep your big toe, or encourage your big toe to stay on the out part and more along the midline instead of going inward. It's not holding it in place and kind of forcing it to stay in place. It just encourages in that direction. I prefer gentle reminder instead of forceful reminders. So this is how I initiate the taping, and then I always find out, like after wearing it, and this is my instruction, I ask the patient, or if I'm taping myself, once I remove this, what did I wish to do to the bones of, go ahead and point down this way, to this area. Typically, you start feeling after you remove the tape, however long you keep it on, what it made you want to do to these bones here. Sometimes you wish you could rotate them outward, sometimes you wish you could rotate them inward. So when it comes to taping again, I keep in mind what I wish to do with those tarsal bones, those little bones I just pointed to. So in addition to taping the big toe, I start taping according to, let's just say in this case, these bones, we wish we could move it that way. So then I'm gonna tape upward in that direction, depending on what's going on. But this is the first step, and we always modify our taping based on the result that we get. So anyway,